So question number 3 in the MCQ series. An infant born with a large defect in the central tendon of diaphragm. The condition is most likely the result of malformation of which? When you hear the central tendon, it means septum transversum. So the answer is D. The central part is the septum transversum. We call the central is the septum, while the dorsolateral part is from pleuroperitoneal membranes. And after that, the muscular part from the thoracic muscles, and the esophageal mesentery forms the crura part of the diaphragm. So the answer of this question is septum transversum. Let's go, because it's an easy question actually, to question number 4. Question number 4 is herniation of abdominal viscera occurs at which age of fetal life to develop diaphragmatic hernia? So basically it's at the age of the return of the abdominal viscera from outside the abdominal cavity to its inside, just before the step of fixation to posterior abdominal wall. And it happens at number B, 9 to 10 weeks. And at this time, simultaneously, the pleuroperitoneal membrane is not closing, so the abdominal viscera escape or migrate to the thoracic cavity. So the answer is B. Question number 5. Commonest cause of development of Bogdalic hernia is weakness in. So you know that the Bogdalic is posterolateral hernia, so it is due to the two-syllable dorsolateral part. The posterolateral, the pleuroperitoneal membrane is the postero or dorsolateral part. So Bogdalic hernia is the weakness in the dorsolateral part. Okay. Question number 6, which is a relatively difficult question. Which of the following statements regarding the congenital diaphragmatic hernia is not true? Not true. So all of the sentences coming down, they are true. Someone you will have a doubt in it, so stop with it or skip it if you are not sure. The incidence of left-sided lesions is higher than the right-sided lesions. This is a right statement. Why? Because the diaphragm on the right side closes first and precedes the left side, and due to presence of the liver, it happens first, and it's less likely to fail in closure than the left side. So comparatively, the left is more common to be open than the right, because the right precedes the left. Number 2, the malrotation is to be expected. Yes, when the abdominal viscera migrate outside the colon, migrate outside the abdominal cavity during the organogenesis, and then they return again to the abdominal cavity, there is a failure of fixation to the posterior abdominal wall. That's meaning that when they migrate or escape to the thoracic cavity, they are not fixed to the posterior abdominal wall, so malrotation is more likely. Left to right shunt via patent ductus arteriosus is a serious but expected physiologic consequence. This is a wrong answer. It is right to left, not left to right, because of the pulmonary hypertension is more expected. So the answer is C. To go again for the last two sentences, survival rate of 75%, this is right, and it was historically 50%. It's now in the highly dangerous diaphragmatic hernia with high risk, it's 75 to 80%. And the congenital heart disease is present in 20% of the infants. This is also right, about 15 to 25% associated cardiac anomalies. Thank you.